Welcome, and thank you for joining us today. This is the question and answer session for January 8th. Public Health Director Annette Rodriguez, Dr. Chris Berg are addressing questions received this week. Please feel free to add your follow-up questions to chat. You can follow us on social media at CBCovid, at CBCovid. That's the journey. Today's questions are going to focus on vaccines and hospitals. Director Rodriguez, you have the first question.
Okay, so with topic one, the vaccine clinic. The question is, how can we help with the COVID-19 vaccine clinic? So there's a lot of ways you can help, but I'm going to tell you the major way is being very patient, okay? Because this is a really huge mass event. And so we need to be patient. But also, if you have like questions or commentary, or you're just wanting to have a conversation, if you could hold those thoughts until you get to the waiting area, which is you're waiting to make sure you didn't have any adverse reactions to the vaccine. It's a 15-minute wait. Some people it's 30 minutes if they have severe allergic reactions. You can ask all your questions in that area, because everybody behind you is really anxious about getting their vaccine, and so we're really trying hard to keep the line moving, so we're really trying not to answer a lot of questions. The other thing is, if you have questions about whether or not you should get the vaccine, you really need to be talking to your doctor before you even come through our line. We don't have physicians there that are saying, well, let's talk about your medical history, let me check your vital signs. We're not doing any of that. This is a decision that you've made to get COVID-19 vaccine, so we're just vaccinating at that point. So that would be the way to help. The next question is, what do I have to bring with me? So what's really important is wearing a short sleeve. And I know that the weather might be colder next week, but you can wear a jacket while you're in your car. You can have your heater going. But once you get up to where it's time to get vaccinated, if you could have that jacket removed, so that way when you get up to the vaccination nurse, you could just pull that sleeve up. It's not one that's tight fitting, and you don't have to take your clothes off there. You can just pull your sleeve up and we get vaccinated, and then you can move straight ahead and wait those 15 minutes. That's what would really, really be helpful to us. So if people are asking about ID, those types of things, we shouldn't need them, but it's always good to have them with you, but we shouldn't need those things. The other thing is, if you're wanting your right arm vaccinated, you should sit on the right side of the car, either on the passenger side or behind the passenger. If you're wanting your left arm vaccinated, you could be the driver or you could be sitting behind the driver. But if you're wanting your right arm and you're sitting on the left side and then you're trying to turn around or get out of the car, it just slows the lines down, and we're really trying to be courteous to everybody in line and to keep those lines moving. So that would help us. So the next question says, does pre-registering guarantee that I will receive a vaccine? You know, you'll receive a vaccine, but you may not receive it that day. And the reason I'm saying that is because if you pre-registered on Sunday for Monday, we don't start Monday's drive-through until after we receive vaccine, which could be maybe 12 o'clock, 1 o'clock. We're shooting for 12 o'clock. But the state of Texas has told us that if your vaccine gets delayed on Monday morning, that's because of weather somewhere in the United States, and your vaccine may be on a truck somewhere. So it's not because of them, it's because it's being delivered. So will you be guaranteed a vaccine? So you pre-register. I would like to tell you absolutely. Here's the issue. So if you pre-registered, you came in, let's say you got there at 3 o'clock. Well, there's 2,000 cars in front of you. So we do have to close our clinic at some time. And so we're also registering on site for individuals that are there that haven't pre-registered. We're trying to get them all registered on site. And so by the time we get to you, it could be after 8 p.m. at night. It's hard to see at this point. So no, we wouldn't be able to vaccinate you until the next day. And you would still have your QR code, and it's still good for the next day. So just come back in, but come back in early so we can get you to the line. So another question is, are restrooms available at the vaccination clinic? And the answer is yes. So we have porta potties that we purchased, and so they're going to be at stations 1, 2, and 3. So you should be able to pull over, go to the restroom and then get back in the line. That should not be an issue. Another question is, Do you have any advice on checking availability of vaccines from local providers? Are there different methods if you're in phase 1A or phase 1B? And actually there is. So if you go and visit our website at www.cctexas.com, there is a provider link there. You can click on the link and then you can actually see who the providers are in Corpus Christi. So you might see Spahn Hospital, you might see HEB, you might see Promptu Urgent Care. And what you need to do, or Amistad, what you need to do at that point is you need to actually call them to see if they still have vaccine available and what their process is for you getting into one of those clinics to get vaccinated. That's a great question. So the next question is, how many vaccines have been received and how many have been given? So currently we've received 0. So for today, for this week, the last week we received 500, we gave out 570. So sometimes you get more vaccine in the vial than just the 10. The week before we received 100 and we gave out 107. That's all we've received. We have not received any vaccine this week. And on Monday we're expecting to receive 4,000 vaccines. That's very exciting to us. Also, Cameron County is getting 1,000, Hidalgo County is getting 6,500, and Webb County is getting 1,200 on Monday. So it's exciting for our region. So the last question I have here is, if infected with COVID-19 between vaccine doses, is the second dose still effective? And that's a great question. And so the answer is that if you pick up COVID-19, and we have had some people that they actually got vaccinated, but then they're positive PCR that they actually picked up COVID-19, that just tells us that they were already probably incubating, which means that they had already picked up the virus before they actually got the vaccine or built up any antibodies, and so it came down with COVID-19. So the second dose would be effective, but what they're telling you is that you can wait up to 3 months from getting the virus and getting that second dose. And then once you get that second dose, you'll get that kind of booster, that robust immunity, and then you should be protected for COVID-19 at around the 95% effectiveness of the vaccine for the 2 doses.
Right, and again, that's only if you contract COVID after getting your first dose. Otherwise, you want to get that second dose at the prescribed, was it 2 or 3 weeks, depending on the vaccine?
Right. For Moderna, it's 28 days, and for Pfizer, it's 21 days later.
Oh, that's right, 3 or 4 weeks. Thank you.
Right.
Say, the next question, we try to give Public Health Director a break here. I thought I could handle this one. She'll correct me if I'm wrong, but how long after you receive the second dose of the vaccine until you're considered protected? And so, as far as I know, it's about 2 weeks after the second dose is when you're considered protected, and that's around 95% for Pfizer, and was it 94% for Moderna after that second dosage?
Yes, yeah, they were very close. I say 95% for both of them, but you're right. 2 weeks after.
Okay, next topic, going on to hospitals. So how can we not have more beds available if we've known this was going to happen for months? What happened to setting up temporary wards? Was no preparation done for this? And so you have to understand that right now the hospitals, while they may be strained, we're not strained nearly as much as we were in the summer, at least not yet. And even then, there was enough capacity to handle the COVID load to make a clinic in which there are plans in the works for this to activate if we should need it, but it costs a lot of money, and we can't just go and spend millions and millions of dollars setting up additional hospital facilities when they might not be needed. And so based upon the modeling that we've been doing, and if we keep behaving the way we have been, we're not really seeing a need in the projections for additional hospital capacity. Now, that could change if our behavior changes. If we stop responding, say, when business capacity rolls back to 50%, or when bars close, if we don't change our behaviors, then maybe things, maybe the projections would change. That being said, we don't want to have too many beds because that's a waste of our taxpayer dollars, and we obviously don't want to have too few beds. And I think you've heard me saying for a couple weeks now that a good analogy for the way the hospitals work, it's like an oil tank with one of those floating roofs. And as it fills up more, as you have more need, the roof rises, and more beds become available for those patients. And so just because you look at the stats and you see there's a certain number of available beds now, it doesn't mean that that's all the beds that are available, period. There's more beds than that. Just those are the number of staffed beds at this point. So I hope I've done a good job at addressing this question. Annette, do you have anything to add to this?
And you did add that, but that's what I was going to say. There are plenty of beds available, but they're not staffed beds, and that's a big difference. And so we did learn a lot of lessons from our first, peak in July. And so there's plenty of beds, but you have to remember too, this is a global event. This is not just a Nueces County event. So when we're asking for more respiratory therapists and more ICU nurses, so is the rest of the world. And so we are trying to get them, and we are trying to get them here even, as we speak. But yes, we did learn our lessons from the first time, and we actually have a bed availability. It's getting staff is the issue at this point.
Right, and I want to reiterate that Nueces County is at least planning for the contingency of if things change and the bed capacity becomes too low for what we need. They are ready to act on that, as far as I know.
I agree.
Okay, next question. How many hospital beds do we have in Nueces County, and how many total ICU beds? Now, I didn't count up all the beds, but I know how many staffed beds there are right now. And through time, through the last several months, the staffed beds have oscillated between about 1,600 and 1,750 beds for the whole coastal bend. And for the ICU beds this week, we're at about 180 staffed beds. Now, if need increases, then those numbers of beds that get staffed could increase as long as we have the staff available to help get them staffed. Moving on to the next question. This is for you, Annette.
Are doctors locally prescribing ivermectin as an early treatment? I don't know the answer to that, to be honest with you. I do know that we're still doing early treatment with Regeneron. We're also doing early treatment with the Illi monoclonal antibody. But as far as that prescribing medication, I don't know. And then the last question, and I guess I just answered it, is do we still have Eli Lilly treatments available? And the answer is yes. And we're also reaching out to the state requesting more at this time. And so we do have a good system set up where we're able to get people that have COVID-19 positive recently, like in the last 3 days, and they have mild to moderate symptoms. We can get them either through the Hector P. Garcia Center, or we can get them in through one of the emergency rooms that we can get them this treatment. And it seems to make their COVID-19 illness shorter. It shortens the duration, but it also keeps them from getting admitted and getting sicker and having to be admitted to the hospital. So it does seem like it's doing what it needs to be doing.
All right. Well, thank you both for taking those questions. Tiffany, were there any additional questions?
There haven't been. This is your chance, everybody.
Going, gone.
Well, I want to thank everybody for tuning in today. Thank you, Director Rodriguez and Dr. Berg. I know you're both very busy, especially with the announcement today. So thank you for taking the time with us. The next task force report will be uploaded on Monday at 3 p.m. to social media. Please join us every Friday at noon, normally at noon, for the question and answer session to the COVID task force. Please remember to direct questions or comments to @CBCovid on your favorite social media platform. And everyone have a wonderful and very safe weekend. Thank you.
Thank you, everybody.